brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. The rhythm of our lives is getting faster. We're being much forced under pressure, under stresses, and through all this hectic life we're being through, many of our colleagues, many of our friends, at a very young age, suffer of a disease or a problem that usually, in the past we would have heard about it to be hurting the elder patients. We're talking about heart attack today. A problem that comes seriously, comes fast, and sometimes it leaves our loved ones in a bad condition. With us today is Dr. Ramy Ismail, Fellow of Cardiac Surgery, Oxford University. Welcome, Dr. Ramy.
Welcome to Huda TV. Thank you so much. It's my pleasure.
It's our pleasure to have you with us today.
Thank you.
Dr. Ramy, what is it with hearts? What is it with the heart attack that people get to have at a very young age? Actually, these days we see
much
20s,
younger ages than before.
Much,
right.
20s and 30s, and you every day you hear somebody is in the ICU. He had a heart attack.
Yeah.
What is it with heart attack? What's the heart attack?
Okay. To simplify from the beginning, Bismillah ar-Rahman ar-Rahim, the heart has a vessel that can delivers blood to it, which is the coronary vessels.
Yes.
And these vessels are giving it blood by a way that when it works more hard or it works, faster, it gives it more blood. Some of our daily uses or daily activities that we can do every day can harm these vessels, and also a lot of vessels in our body. But let's start with cholesterol, because cholesterol is, if it's very high in your blood, and it's obviously will be in your shape, you will find yourself very, very obese or very fat. Yes. And the obesity is starting to become, more prevalent in even younger ages.
Exactly. Yes.
This cholesterol, smoking, even smoking in younger ages, it can, harm these vessels, as we will see now in my video. But also a lot of things, which is like high blood pressure, hypertension, diabetes, elevated glucose level in the blood, family history of heart diseases, all of these risk factors. It's not one reason. There is no one reason for heart attacks. There is no one reason to close these vessels, which is a coronary vessel. Heart attacks means an angina or a pain in the chest. A pain which means that the heart is telling you, please give me more blood, because the blood which is coming to the coronary vessels are obscured. Yes. There is some way that gives me less blood than I am used to.
Yes.
So it gives you a very, very, very tight pain in the chest, especially when you are doing some exercise.
A very painful message, actually.
Yes.
Yes.
Especially when you are doing exercise, when you are eating, when you are running, when you are under stress, everything. Even the Prophet ﷺ was telling us, "La taghdab." Don't be panicked. Don't be angry.
Yes.
Yeah, because angry is the first.
And if you're angry, you have to sit, and if you're still angry, you lay down.
Yeah. Yes. This is the main enemy. You have to do it, because angry will elevate the blood pressure. If I'm angry now, if I'm a healthy person and I just measure my blood pressure, it's 120/80, which is normal. Yes. If I goes angry, I'm a healthy person. But if I goes angry, it goes up.
Yes.
Maybe up to 200. Yeah. But it's a momentary. But this momentary elevation of the blood pressure will make a tears, will make some like shear stress on the vessel from inside, and cholesterol, and diabetes, and elevated blood glucose, and elevated, sedentary lifestyle. You are not moving, you are just eating and eating and eating, and nothing goes to be burned. Yes. All this can harm these blood vessels and make you feel like this pain, which is a heart attack.
So there is no definite cause of
yes, just risk factors.
Just risk factors.
Yes.
But how does it happen?
Okay, let me show you how does it happen. I have here a piece of video. We can see it now. This is a coronary artery which goes around the heart muscle, and the blood goes smoothly. Over years and years and months, there is streaks which forms like a cholesterol streaks over this side, or
That's over the years.
yeah, over the years. It
Yes.
takes years and years to form.
Yes.
These streaks of cholesterol that, I mean, precipitate under the lining of the blood vessel. And when it comes,
Yes.
this streak, there is a fissure inside it, the blood clots over it, there is a stoppage of the blood, immediate stoppage of the blood, which is a heart attack.
Yes.
At this time, the patient feels like he have a big pain in his chest, but it's different from the pain we have spoken about before, because the pain of angina is a momentary pain for 2 or 3 minutes. If you have this vessel is closed, I mean before this attack happens, if it's just narrowed, you feel some pain when you are doing some exercise. And this pain can go and relieved by sublingual nitrates or this sublingual tablets that every cardiac patient know about it. But in this case, if it's a heart block, you need to be admitted to a hospital in order to give you some medication, which is called streptokinase and urokinases, which can, I mean, smooth it out.
Yes, but
This clot, I mean.
when somebody gets a chest pain, everybody who gets a chest pain these days think it's an angina or coming from the heart.
Yes.
And
Especially young people. Yeah.
Yes, yes. I mean, everybody thinks that's a heart.
A young man comes to you, I feel like a
Exactly,
pin here
yes.
in the left side, so it's not a heart.
It's not a heart.
Yeah, if it's like a pin and it's just pointing and to the left side, and in a young man, it's not a heart. It's not a heart attack.
So tell us what's the classical,
I mean,
what's the classical presentation picture?
Yeah.
That the person would know that he's going through a heart attack, and he would what would he do?
okay, first of all, it comes more with exercise. It doesn't come when you are at rest, except if it's late stage.
Yes.
But at the beginning, it comes with exercise. Second, it comes not as a pin or as a pin prick in the left side. It comes all over the chest.
All over the chest.
All over the
and
chest.
it's not directed to the left like people
No.
would tell you.
It's in the middle, and sometimes it can be referred to the left arm, to the jaw, maybe to the left side of the left arm. It feels like numbness or something. It stays for minutes. It's never for seconds, and it's never for hours. If he tells you, I feel some pain for 2 hours, it's not a heart.
It's not.
It should be for 2 or 3 minutes,
Yes.
something like this. And when he gets rest, this is the most important. When he gets rest, when he's doing exercise, there is pain. When he gets rested, I mean, the pain goes away, and it's just anything but not this pin prick, which happens to a lot of people. And let me show you another video
Yes, please.
before we finish up. This video is about how does it happens. This is a coronary artery, a right coronary artery,
Yes.
and this is an atheroma which happens, and this is a blood clot, and this is a heart attack that we have spoken about.
Yes.
But let me start from the beginning. I told you over the years, this streaks or this atheroma or this, atherosclerosis, as we say about it,
Yes.
is going larger and larger, and the vessel is going narrower and narrower. And at this stage, we can treat the patient by a means of medical, therapy, or a lot of things like stent, which we will show you later.
Yes.
But at this stage, the blood is just going in a very hard way because it's narrowed.
It's like gushing through.
Yeah, gushing through. When it happens and there is a fissure in this atheroma, this fissure, the body thinks about this fissure as it's a cut in the skin or something. So it clots over it, as if it's clotting someone who is injured.
With a wound.
Yeah, as if...
But it's inside the vessel.
But it's inside the vessel. So with time and time, within an hour or a couple of hours, the blood is completely cut away from this part of heart muscle. And at this time, the pain will never go away.
Yes.
It's not 2 minutes or 3 minutes. It stays 1, 2, 3, 4 hours until you go somewhere to the hospital, to something, or until this muscle is died completely. But it tells you we have only 6 hours left for this muscle to be saved. If you feel this pain, if any person with anginal attacks feels this pain, he need to have be admitted if it's prolonged
These
more
are the
than
risk
some
factors
minutes.
that you've been talking about.
Yeah, it's a lot of risk factors. Smoking is the first thing, most important thing. Elevated cholesterol, sedentary lifestyle, lack of physical exercise, diabetes, elevated blood glucose, elevated blood pressure, all of these. So this is a normal cardiac rhythm, and this part is the damaged muscle, as we see here, where the blood is cut through a clot in
This
this
is when you
coronary
cannot
artery.
save the patient or cannot dissolve the
You still
the
you still can do this within 6 hours.
Uh-huh.
6 to 12 hours. You need to go to any hospital, any like E&R, and they give you some medications. They give you some GTN spray, which is, or GTN or nitrates, sublingual nitrates, which open up this vessel.
Yes.
But sometimes if it doesn't work, they need to open it up by dissolving this clot. And the only way to dissolve this clot is by using, streptokinase. And what's amazing is this streptokinase, let me tell you, it is formed from the snake poison. Because the snake, when he sucks the blood, he needs this blood not to be clotted inside his mouth. So we taken this poison and we dissolved the clots inside the heart by it.
That's a good piece of information.
Okay.
So there is a difference between what you said, the ischemia or the less blood flow to the heart,
Yeah.
and this gives the angina.
Yeah.
And the other thing is when there is very little blood flowing to the or the cut of the blood to the muscle,
completely cut.
and that's what if you don't
Infarction.
yes, that's the infarction where the piece of the heart wall
Is dead.
is dead,
Yeah.
and you cannot replace it back again.
Unless you save it within 6 or 7 hours
Unless
or
you
half
save
a
it
day.
in a half
Yeah.
day.
If you have the same pain which lasts more and more and more, you have to go and take some good steps for it.
Yes.
That's it. And the most important thing is before you start to have all these things, why don't you get low weight? Why don't you get some diet? Why don't you go to make some exercise? سيدنا عمر بن الخطاب said علموا أولادكم السباحة والرماية وركوب الخيل.
Yes.
Teach your kids to have like riding, like swimming. All of this
Sports.
is sports.
Move your
All
body.
of this working, but just like sitting inside your room by like a TV remote control and doing
Yes.
everything like
That's
without
the
any
modern
effort.
sedentary
This is the
life,
most
maybe.
important thing: the sedentary
Exactly.
lifestyle and the
Yes.
stress.
Yes. Brothers and sisters, we have a short break, after which we will come back and see what we would do if we have somebody with a heart attack. So please stay tuned. We'll be back after a short break. Assalamu alaikum wa rahmatullahi wa barakatuh.
لا إله إلا الله رب العرش العظيم لا إله إلا الله رب العرش الكريم لا إله إلا الله رب العرش العظيم لا إله إلا الله رب العرش الكريم.
Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to our episode of Health from Huda TV. And we're still talking with Dr. Ramy Ismail about heart attack and what would we do if we have somebody who gets a heart attack. It's quite alarming when somebody
it's quite alarming.
is facing a heart attack.
Yeah.
Those who are surrounding him, his family or his colleagues or even people in the street.
Yeah.
They would get alarmed, they would get panic, and most of us really don't know how to deal with a patient with a heart attack. Even the patient himself doesn't know.
Yeah.
Because sometimes
That's the most important thing.
Yes.
The patient himself.
Yes.
Every patient with a heart attack should have in his pocket and everywhere. Like he has a cigarette in his pocket everywhere.
we hope
because
nobody
he-
gets a cigarette in his
yeah,
pocket. Yeah.
Yeah. He should have this sublingual nitrates, this tablet which he does put under his tongue.
That's
It
for
opens
the
up.
people who are used to get heart attacks.
are used to get
But
heart
how about
attack.
people who never know what heart attack is until they get it?
Okay. First of all, this patient with a heart attack could have some alarming symptoms before he get this heart attack, which is like he feels tired. He was not used to be like this before. He is not used to be doing some exercise. I mean, it's like you are eating and eating and eating, and you doesn't burn anything. So it just goes under your vessels. So you feel like you can't move like before. You don't do any exercises. That's why sometime you will find the way that you have this heart attack.
So when he gets the heart attack,
Okay. At the beginning, we doesn't start with surgery or catheter. We start with medication, normal medication. This medication is like some, medication to open up these vessels, the coronary vessel. Some medication to modify the risk factors. Medication for diabetes, for hypertension, to stop smoking, to start walking and doing some exercise, to eat less and less and less, to eat many times, but every time is a small amount of food.
What I mean is, when somebody feels that he's getting a heart attack, a chest pain, just like you described before,
Okay.
chest pain,
Yeah.
radiating or referred to the shoulders, and maybe these
It's not,
symptoms.
it's not typical like this, but he should be alarming if he feels like
What
abnormal feeling
what
in his
action
chest.
should he do, or other people surrounding
Okay.
him should take?
The
Until he gets a
the
proper
first thing,
medical
the
service.
first thing is you say, "Help, please help me,"
Yes.
and you go somewhere like a hospital, not a school or something.
How
like,
about
yeah,
if he's
hospital.
not in the hospital?
Okay, you mean in the street?
In the street, exactly.
In the street, the first thing you do for him is you keep him lying down. You don't take him up
Yes.
like we do, because the heart is located like here in the middle of your chest, and the brain is located up.
Yes.
So the heart needs some effort to lift this blood up. And if you have some problem with the heart and it doesn't work efficiently to lift this blood to the brain, which is more important than the legs, and the legs is more easily to go down the blood because it's with gravity,
Yes.
Allah makes him lies down by himself.
Subhanallah.
So the position of the legs is the same as the position of the head.
You don't raise the legs as we see some people who do that?
That's more important.
Yeah.
We see in the streets they take him on a chair, so the blood goes down again. No, you have to leave him lying down, but you have even to lift his legs up,
You do
so
lift
the
his
blood
legs.
goes more and more and more to his brain. His
Yes.
brain is more important than his legs.
Yes.
That's the first thing. The second thing is to keep a roomy area around him, because he needs more oxygen to this damaged area of the heart. The third thing is to give him analgesia, something to kill the pain.
kill the pain.
Because he even can get troubles not from the heart, but from a pain. He can get like a neuropathic shock,
Yes.
something from the pain. The most important thing, to give him some fluids to keep his blood pressure up, and at the same time to put inside these fluids nitrates, which is so famous. If you go to a pharmacy and tell him, please give me some nitrates, some sublingual tablets, and even if you don't know its name,
Yes.
that's the tablets that the heart people take it under his tongue.
Yes.
He will give it to you, like it's very cheap. You put one under his tongue, it will open up. If not, you put another one. If not, you put a third one. Until this point, if it goes away and everything is relieved, he is okay. If it doesn't and it stays for more, there is no way to do anything to this man. You have to take him to the hospital to do what we will show now in this video.
Yes, but that's quite... Because some people would attempt to do some CPR, the cardiopulmonary resuscitation.
Okay.
Some people... If the patient or the one who's suffering from the attack has passed out, I mean, if he faints or
You
something...
shouldn't do CPR unless you are sure that there is no pulse and the heart is not working. If you are doing a CPR to a working heart, you will stop it.
You will stop it.
Yeah, because you are giving, like you are making interference with the normal pathway of electricity inside the heart. So you have to feel first, and you have to listen to his breath going out and in, and you have to feel it on your hand or something, that the air is going out and in. He is breathing. I can feel the carotid artery or any artery. It's just beside your neck. Yeah, it's just like...
You should not do the CPR, or you should not do
Yeah,
the
if I
medical
feel it,
Yes.
if I feel it, I shouldn't do a CPR.
But if you don't...
If you don't feel it, and you are
sure
sure that you don't feel it, you don't hear any breathing coming out or in, you don't see any movement in the chest, he doesn't breathe. At this time, first thing you call for help,
Yes.
because you are not having the power to do CPR more than 5 minutes, because it's very vigorous, you will be tired so fast. And the second thing after calling help is to do this CPR on his chest. By the way, we may show in another episode. And
Yes.
it's a very difficult.
It's very important
yeah,
to
it's
know
very
how to
important
do
everyone to learn, even in the street, because it may happen to your neighbor, it may happen to
Exactly.
anyone. But the first thing to do is just, as we have said, to make a roomy area around him, to give him some press, and to give him a way to go to the hospital to do some like.
But there are some regulations these days, maybe in the factories, maybe in and
Yes.
even the movie theaters,
Yes.
that they should have the automated defibrillator. I know
Yeah.
this might be quite expensive for some, but
Yeah.
actually the regulations are coming up that it has to be there. It has to be, and this machine,
I
maybe
mean, if the heart stops,
Yes.
you give like a shock.
Yes, it
That's
gives
right.
like a shock.
Sometimes. But we don't want to fear the people from these heart attacks because it doesn't go to this far, I mean, away that the heart stops or they need a CPR.
Yes.
Most of them, they just need like a catheter at the same time of the heart attack.
Uh-huh.
If it lasts more than an hour or 2 or 3,
Yes.
and you are used, it's just 2-3 minutes and at this time. So let me show you this video
Yes, please.
of a catheter.
This is what we do for a catheter.
Yeah, a catheter is just we go by a wire inside a vessel from the leg or the arm or anything, and we just go up and up and up with it, and it will reach us to the heart. And then in the heart, we will go under a monitor. We can see everything. We can't see everything, but we just imagine where is the coronary artery, and we go with the wire inside it on the screen after putting some dye to see where is the blockage. We go with this wire like this, and over this wire we go with a small tube. This tube have a balloon at the end of it, and a stent which is deflated, and we inflate the balloon, and this balloon will open up, and the stent will open up and widen the blood vessel, and the blood goes back and forth again, and everything become okay. But this, if it happens, I mean earlier, it's better. But if you are an angina patient, as we say, it's not necessary to have it right now. It could be elective.
Yes.
Just if you have a problem which stays more and more and more and make it trouble with your life. You can't even go to the bathroom until you have an angina attack. So if it's like this,
that's
you have to
crucial.
do this
Yes,
catheter.
that's quite
If
crucial.
it's just like having an angina attack and you use this subnitrates, sublingual nitrates every like a week or 2, you could be only controlled with medication.
Yes.
Okay.
So for the patients, do you have another video?
Yeah,
for
I
us?
have it, if you please. This is called the percutaneous coronary intervention.
Yes.
And this intervention, by the same way, it happens like this. This is a narrowed coronary artery, and it goes from any vessel in the body because it's all closed network. Mostly it goes from the femoral vessel, which is supplying the leg, and goes by a small wire, as we have shown before, inside the blockage. And they try to just like open it up, but it doesn't open just like this. You have to put something like a balloon, as we have said,
Yes.
and this balloon can
And
inflate
then you
it up.
put the stent.
Yeah, you just need to inflate it. But even there's another problem, that this stent is a metal, and the body is not used to have a metal inside the blood.
Yes.
So the blood will clot over it as a foreign body.
So what we do?
So we have 2 options. The first option we have done before is we put some thing like I mean lining of this stent. When we make it in the factory, we line it with something that make the blood more thin, so it doesn't clot.
Yes.
Or if we don't have this option, we give the patient some medication to make his blood thinner, so it doesn't clot for 1 year or something until the body is used to this stent.
Okay, so if we have this infarction that you said about the death of part of the heart,
Okay.
could we repair this? If the stent is not working, what's the role of the open heart surgery here?
Okay.
I know this is your favorite part.
Yeah, this is my favorite part. The most liked place for me is the heart operation surgery. I mean,
So
operation
tell us
room.
about, in
Okay.
brief, please.
When it's not possible to do a catheter, when there is no, okay, there is only one vessel, we do a catheter. If there is 2, 3, 4 vessels which is closed, especially if it's main vessel, we can do a catheter on them. So we have to do this thing, which we open up the chest, we go inside the heart, we take some vessels which is a reserve vessels that Allah created for us from the leg and from the arm and from the chest and from a lot of places, and we put it as a graft, like something like a bypass. It's
Yes.
called the cabbage.
A cabbage.
Coronary artery bypass surgery, and it works fine for years and years, alhamdulillah.
Alhamdulillah.
Alhamdulillah. This is, I mean, it's
Do you have some advices for our viewers about how
Yeah.
not to reach to the limit of having a heart attack?
Yeah. I remember the story when the Prophet Muhammad ﷺ was receiving some presents from another country.
Yes.
And among these presents was a doctor. So he received everything, and he doesn't receive the doctor. So when the doctor went back to his home country, they told him, why didn't you go with other things? He told them, the Muslim have one ayah, one verse in Quran which contains all the medicine. They told him, what is it? It's in Surah Al-Baqarah, and it says, وَكُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا. Eat and drink whatever you would like, but don't over it.
Yes.
Don't make it over. Al-Mi'da baytu da, as the Prophet ﷺ said, the stomach is the home
house of
for every disease.
Yes.
The blood pressure, the high blood pressure is from the stomach, from eating more salt. The diabetes is from the stomach, the cholesterol, the obesity, the smoking, everything is coming from the stomach in the beginning, and it will give you the other way around, that's the heart attack.
Subhanallah.
Subhanallah. And it's from one hadith that Prophet ﷺ said 1400 years ago.
Alhamdulillah.
Alhamdulillah.
Dr. Ramy, thank you very much for being with us today. We're glad.
It was my pleasure.
Yes, thank you very much. It's our pleasure.
Thank you so much.
Dear brothers and sisters, this concludes our episode for today. Our email is still health@huda.tv, and our website is huda.tv. Please join us. Watch us live on the website, and please write to us. Until then, we wish you a happy and a healthy life, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.